5 supplements all men need to start taking today. Did you know that the nutritional requirements for men and women are different? And they also change as you age. You need a variety of nutrients in the right proportions to fuel your body. You will get that with a good diet. A supplement can assist fill in nutrient gaps when it can be challenging to obtain the required daily allowance of important nutrients through diet alone. Naturally, it's crucial to pay attention to what you put into your body. That's why knowing the right supplement for you is crucial. Attention all gentlemen, if you're scratching your head over which daily vitamins to take, we've got your back with the ultimate solution. And that's not all, we're also spilling the beans on the supplements you must avoid like the plague. So let's jump right into it. Here are 5 essential supplements for men that could change your life for the better. Starting with number 5, Vitamin A. Having poor vision is no way to go through life. If you're a young man, you should start taking care of your eyes early on. Lucky for you, Vitamin A is here to help. This fat-soluble vitamin promotes good night vision and eye health. Foods high in vitamin A can support healthy vision and a strong immune system while also lowering your chance of prostate cancer. Many foods including milk, cheese, salmon, broccoli, carrots, green leafy vegetables, squash, cantaloupe, mangoes, and apricots contain this vitamin, but numerous drugstores sell them as pills. Vitamin A is required by the body to promote a healthy immune system and skin. For men aged 19 to 50, the recommended dietary amount or RDA for vitamin A is 900 mg per day. Number 4. Vitamin C. As an antioxidant, vitamin C supports a strong immune system and aids in the body's ability to combat harmful free radicals. It might also help the body absorb iron. A review of more than 100 studies conducted over a 10-year period that was published in seminars in preventive and alternative medicine found a growing number of potential advantages of vitamin C. Greater blood levels of vitamin C may be the optimum dietary indicator for overall health, according to study researcher Mark Moyet, MD, MPH of the University of Michigan. Vitamin C has garnered a tremendous deal of attention, and for good reason, he adds. Vitamin C consumption can also reduce the risk of BPH, or benign prostatic hyperplasia, which is an enlargement of the prostate that commonly affects older men and impairs urinating. Number 3. Vitamin D. Another vitamin that is essential for your body is vitamin D. Vitamin D is needed by your muscles with every movement. Moreover, this vitamin supports calcium absorption and maintains a robust immune system. This fat-soluble vitamin aids in calcium absorption to build strong bones and teeth. By helping to control your body's immune response, vitamin D also maintains the health of your immune system. A little more than 95% of men and women do not consume enough vitamin D through diet alone. Most of these supplements work so well together. Imagine if you took them all. You would be limitless. But don't go anywhere because there's so much more on this list. Now let's talk about number 2, magnesium. Some people take dietary supplements to control their weight. A key ingredient to those supplements is magnesium. This essential mineral supports hundreds of metabolic reactions. Magnesium assists in the conversion of food into cellular energy and supports the health of bones, nerves, and muscles. Many males do not consume enough of this mineral. Magnesium may help to strengthen your immune system and fend off heart disease in addition to supporting strong muscles, neurons, and bones. Make sure to only take the recommended amount as instructed by professionals. RDA for males aged 19 and over is 400 to 420 milligrams per day. And lastly, for our number 1, calcium. Healthy bones, nerves, and muscles are maintained by this mineral. Men in their 20s should focus on getting adequate amounts of calcium to grow strong, dense bones. Having enough calcium and vitamin D in your diet, coupled with regular exercise, is essential for bone health and may lower your chance of developing osteoporosis later in life. You won't be needing a cane if you take this supplement. Focus on the key nutrients mentioned earlier and start incorporating them into your daily routine pronto. But to take your overall well-being up a notch, don't forget to amp up your intake of vital elements such as fiber, vitamin K, and zinc. Got the lowdown on what to take? But hold up, do you know which supplements are a big no-no? Yep, some of them can actually do more harm than good to your precious body. Because let's face it, we all respond differently to various nutrients and minerals. So it's time to call out the supplements you must steer clear of. Brace yourself, because here are just a few of them. Starting with number 4, selenium. If you don't know what selenium is, it is a trace mineral that can be found in breads, grains, meat, poultry, and fish. It's another antioxidant that has been studied at high levels to determine whether it might prevent chronic illnesses like cancer. However, according to Alan Crystal, Dr. PH, a professor in the Public Health Sciences Division at the Fred Hutchinson Cancer Research Center in Seattle, the selenium experiment that was done in patients years ago to prevent recurrence of skin cancer actually increased the recurrence of skin cancer. The most recent investigation even revealed an elevated risk of prostate cancer in some men. You're already getting enough of this mineral from your foods, so it's best to stay away from it as supplements. Number 3. Beta-carotene. Just by its name, can you guess where this mineral can be found? You're right, it's from carrots. The intense red-orange hue of carrots, sweet potatoes, and melons is due to this antioxidant. It's a great example of a nutrient that was thoroughly investigated in animal studies in the 1960s and 1970s, and even in some human observational studies, according to Howard D. Sesso, SCD, MPH, an associate professor of medicine at Harvard Medical School in Boston. These studies suggested greater amounts of beta-carotene intake would result in a lower risk of cancer. Yet, according to Dr. Sesso, the studies examining individual beta-carotene supplements and vitamin A provided quite persuasive evidence that the prospective benefits were not real. He continued that some research even revealed an elevated risk for lung cancer in those who used them, particularly among male smokers. High quantities of vitamin A can be toxic because the body retains excess amounts rather than excrete them. You really need to know about the last two on this list, so make sure to watch until the end because your health depends on it. Now let's move on to number 2, fish oil. We all thought fish oil was healthy, right? Like, people were talking about how it can support brain, heart, and eye health. Well, a recent study from the National Cancer Institute warned men about taking omega-3 fatty acid supplements because it links them to increased risk of prostate cancer. The study, published in the Journal of the National Cancer Institute, adds to the growing body of research showing that men who have high blood levels of omega-3 fatty acids are more likely to develop prostate cancer, the most prevalent form of cancer in males. Researchers discovered that men with the highest blood levels of omega-3 fatty acids from fish had a 43% higher risk of acquiring the disease than men with the lowest levels. On the other hand, they discovered that males with higher levels of the omega-6 fatty acid linoleic acid had decreased occurrences of prostate cancer. Salicornia, safflower, sunflower, poppy seed, grapeseed, and evening primrose oils all contain significant amounts of linoleic acid. Fish oil still has its benefits and it's one of the healthy fats that you can consume. If you're planning to take fish oil as a supplement, try to do it in moderation, or better yet, ask your doctor if it's safe. And lastly, for our number 1, kava. With some success, kava is an herb that has been used in concentrated form to treat generalized anxiety disorder. According to a study, those who have generalized anxiety disorder may benefit from using the South Pacific plant instead of prescription medication. However, taking kava in abundance or over an extended period of time has been connected with substantial liver damage such as cirrhosis, hepatitis, and liver failure. This herb is great to calm you down, but the hospital advises against drinking alcohol while taking kava owing to probable liver damage. And now that you're in the know, drop a comment down below by letting us know what supplements you currently take, or which ones you want to take. Remember, here at Healthee, your body is our number 1 priority. Thanks for watching until the end, and we'll see you in the next one.